Before you start taking Zykadia, make sure to read the Patient Information Leaflet from your pharmacist. Take this medication by mouth with food as directed by your doctor, usually once daily. The dosage is based on your medical condition, lab tests, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. Drugs that reduce stomach acid may make you absorb less Zykadia. This could make Zykadia work less well. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says you may do so safely. Use this medication regularly at the same time each day to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. If you vomit after taking a dose, do not take another dose at that time. Since this drug can be absorbed through the skin and lungs and may harm an unborn baby, women who are pregnant or who may become pregnant should not handle this medication or breathe the dust from the capsules. Some common side effects of Zykadia may include diarrhea, nausea, vomiting, abdominal pain, loss of appetite, heartburn, constipation, or tiredness. If you experience severe nausea or vomiting, your doctor may prescribe medication to help. Eating small meals, avoiding food before treatment, or limiting activity may also reduce these side effects. If any side effects persist or worsen, contact your doctor or pharmacist. Serious side effects of Zykadia may include numbness/tingling, symptoms of liver problems, vision changes, weakness, trouble breathing, cough with or without phlegm, fast/slow/irregular heartbeat, severe dizziness, fainting, seizure, or increased blood sugar. If you experience any of these serious side effects, contact your doctor immediately. In rare cases, Zykadia may cause a severe allergic reaction. Seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Additionally, contact your doctor if you develop a rash while taking Zykadia. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you experience any side effects, contact your doctor for medical advice. Before taking Zykadia, it's important to talk to your doctor or pharmacist if you have any allergies or if you have a medical history of diabetes, high blood sugar, or liver problems. Zykadia may affect the rhythm of your heart, causing a serious and potentially fatal irregular heartbeat. This risk may be increased if you have certain medical conditions or if you are taking other medications that can also affect your heart rhythm. It's important to inform your doctor of all the medications you are taking and any existing heart conditions before using Zykadia. Low levels of potassium or magnesium in your blood can also increase the risk of heart rhythm abnormalities when taking Zykadia. Be sure to discuss this with your doctor, especially if you are taking diuretics or have conditions that can lead to electrolyte imbalances. Zykadia may also cause vision changes and make you more sensitive to the sun. It's important to limit your time in the sun, use sunscreen, and wear protective clothing when outdoors to avoid sunburn or skin damage. If you are pregnant, planning to become pregnant, or breastfeeding, it's important to discuss this with your doctor before using Zykadia, as it may harm an unborn baby. Women should use reliable birth control during treatment and for a period of time after the last dose, and men should also use reliable birth control during treatment and for a period of time after the last dose to avoid potential harm to a developing baby. It's important to be aware of potential drug interactions with Zykadia. Other medications, including those that may slow the heartbeat or affect the removal of serotonin from your body, can impact how Zykadia works. It's important to keep a list of all the products you use and discuss them with your doctor and pharmacist. Some products that may interact with Zykadia include other drugs that may slow the heartbeat, azole antifungals, macrolide antibiotics, and drugs for seizures. Additionally, Zykadia can affect the removal of other medications from your body, which may impact how they work. It's important to talk to your doctor about any concerns regarding potential interactions. If someone has taken too much Zykadia and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the United States, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share Zykadia with others. Before starting this medication, you may need to undergo certain lab and/or medical tests, such as liver function, blood sugar, EKG, complete blood counts, heart rate, and amylase/lipase level. These tests should also be done while you are taking Zykadia. It's important to keep all medical and lab appointments and consult your doctor for more details. If you happen to forget to take a dose of Zykadia, take it as soon as you remember. However, if it's less than 12 hours before your next scheduled dose, it's best to just skip the missed dose and take the next one at the usual time. It's important not to take a double dose to make up for the missed one. Remember to always follow your doctor's instructions when taking Zykadia. When it comes to storing Zykadia, it's important to keep it at room temperature and away from light and moisture. It's best to avoid storing it in the bathroom, and always make sure to keep it out of reach of children and pets. When it comes to getting rid of Zykadia, don't flush it down the toilet or pour it into a drain unless specifically told to do so. Instead, make sure to properly dispose of it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.